This is the third video dedicated to the ICOH Congress of Dublin. Today, the scientific program has been really busy, and I've selected some of the communication I'd like to deal with you right now. So the first of these is a semi-plenary talk performed by Agnès Parent-Thirion, working for Eurofound, and she dealt with the 6th European Working Conditions Survey, implying 43,850 face-to-face interviews performed in 35 countries, in 49 different languages, and with interviews lasting for 45 minutes each. She presented the data concerning the 2015 edition with a really huge focus on the question of job quality. So job quality has been studied with 7 different dimensions, and I will be talking about 3 of these 7. First of all, Agnès Parent-Thirion has talked about the physical environment with 13 different questions which help to assess the quality of this physical environment, meaning talking about lifting, about chemical exposure, and so on. So, with years passing, globally, the physical workload is globally decreasing. But if we have a look on specific items, we can see that some physical specific workloads are increasing, especially the question of lifting or moving people. This is something that is increasing over the years. Another physical environment item that was also increasing during the past years was the handling of infectious material. The second dimension of job quality I'd like to talk about is the question of working time quality. Agnès Parent-Thirion has told us that she were horrified about the data produced by the study concerning that issue. In fact, talking about working time quality is talking about number of workers working over 48 hours a week, or not having 11 consecutive hours between 2 shift works. And she told us that 23% of the working force included in the study do not benefit from these 11 hours of non-working time between 2 shifts. So that is really important. And the last element I'd like to talk about is the question of skills and training that was raised by this survey. And of course, as you probably know, I'm French, and I have had a look at the data produced concerning my country, and we are a really medium country concerning the training provided by employers concerning workers. We are in the middle of the ranking, but concerning workers who are asking for a training at the workplace and not receiving any training, we are the second country, just after Denmark. So, well, this is something that should be improved in order to have some positive side effects on mental health. The second communication I'd like to talk about was the talk of my colleague, Professor Alexis Descata, who is a professor of occupational health in the University of Versailles-Saint-Quentin, and that's why I'm dressed that way with a tie and a shirt. I'm not always dressed that way, and I'm dressed like this because I was co-chairing the session with the past dean of the Irish Faculty of Occupational Health, and I was quite honored to be at this position for this communication. So Alexei has explained us the story and the emergence of the specific group in the ICOH dedicated to the question of emergency and occupational health. And So he told us that there is a difference between public places and workplaces, because in workplaces you expect to have people in better health because of the healthy worker effect, of course. Cardiac failures in the workplace have a better prognosis than cardiac failure that occur elsewhere. So this is really interesting, and this word that I wasn't aware of. Well, and he also told us that the management of emergency in an enterprise can contribute to offer to stakeholders, to employers, a different view on the occupational physician. If the occupational physician is able to perform a good management of a critical emergency situation, well, it can be seen as somebody more important, and this could provide some positive side effects if this physician is asking for other improvement of the workplace that are not directly related to the emergencies. That was quite interesting. Another parallel session I attended was the session dedicated to the WHO-ILO joint methodology to estimating the burden of work-related disease and injury. So this is a worldwide work performed by 100 workers, and I'm part of these workers, these researchers involved in that project. This is a really, really huge project that has just been started recently, so we do not have really interesting data to provide. It was just a talk about the methodology. So there will be 9 different systematic reviews performed, making some links with risk factors and some health outcomes. So you have a look on one health outcome, and for example, you have 100 people suffering from major depressive disorders, and among these 100, you try to estimate how many have a depression that is related to the working condition. So that's the work that is to be done in this systematic reviews group. So there are links between, example given between occupational noise and deaths from cardiovascular disease. And personally, I'm involved in the group studying the relationship between long working hours and depression. So there will be a lot of work that will be performed, and that will be leading to some publication in the future. The last session I attended was entitled Participatory Approach to Improving Safety and Health in the Construction Industry. It was really not crowded at all, and that was a bit worrying because all of the researchers have worked hard in order to prepare good communications, and obviously these were good communications. And talking about a way to consider the worker and the relationship between the worker and his activity at the workplace, that is really French. This is the comprehensive approach. This is the case when you try to understand the worker's point of view. Example, Andale has been talking to us concerning some ergonomic devices that could be used at the workplace on construction areas. So some devices in order to remove old floors, so old carpets, and she was saying that, okay, these devices are really good, and they allow the worker to have a less awkward position. But how? What is that? What aren't the workers are using these devices? And she was explaining that it's okay, but it doesn't work on old carpet. It is not removing that good, and if the room is too small or with weird shape, it is not possible to use the device. So it's really interesting to have this kind of view, because workers are not children, and we are not here to educate them and to tell them one way how to proceed at the workplace. They are experts of their working conditions, and they know better than me as an occupational physician how to do the work. So we have to understand that there are obviously logical reasons for them not to use the devices, and these works have been the opportunity to show the kind of reasons that could be raised not to use the ergonomic devices. That was really interesting. So to conclude that video, that is a little too long, I acknowledge that. I have been given the last device badge provided by Morocco concerning the application for the organization of the 2024 ICOH Congress, and I've been given other presents. So all of these is supposed to help me to make my choice, and there is the pins from Montreal, or not Montreal because it's not the Quebec flag, it's the federal flag of Canada. Well, so I will be choosing with between all the cities that are running for this organization. So Mumbai, the T, Bangkok, the elephant, the badge Marrakesh, and the pins from Montreal in Quebec. So, well, I will be voting and I will be giving you the final result, but I won't tell you which one I voted. Of course, this is secret. Let's see us again on tomorrow for other information concerning this ICOH Congress.